gotta tell you, the best app I've ever seen recently was about a year ago. Was called Asthma MD, and it's for kids to manage and track their asthma health in terms of the drugs they're taking, how well they're doing in terms of breathing. That it has all the ingredients that I think a mobile app needs to have to be successful. It's consumer directed, it's clinically effective and relevant, it's simple to use, and it touches a lot of people's lives. You can't get any better than that. And I think those are the factors that have to be handled.
I agree with you. One of the things that I do want to add, as we look at the landscape, as we see where the needs are, as we hear sort of the voice of, I would call it the voice of our members, I think we end up with, sort of wireless sensors, right?
Yeah.
With, let's think of it as sort of, I guess we could say, applications running in the cloud in many ways, and a way to get that information. There may be big data is the way to deal with that. Analytics on top of that, and everything is really converging around mobility. So this is what our members are asking, right? This is what we are providing. This is what the physicians are asking, right? So, basically, so of course, our challenge, but the trend is there, right? I think the wireless sensors, and we hear that from our members that are very interested, let's say, in health and fitness, right? And on the other end of the spectrum, we have people with chronic conditions that can be better managed at home, right? And the studies have actually proven that. So to me, this is something that, and the big, opportunity is how do we deal with the large amount of data, right, that we are generating and we will continue to generate, and how do you provide tools on top of that to effectively amplify the time of a physician, right? And going away from sort of this one-to-one interaction into more of a transparent but many-to-many interaction.
So one of the use cases that I come across, and as a consumer of health myself, if I take an app to a doctor and say, look, I've been tracking this, they're going to look at me and they're going to say, well, what do I do with it? If I give them a paper sheet, they're going to say, what do I do with it? So I think it's not just important only to gather data and capture it. It's also the ability to utilize it in such a way that it's easily accessible to your physician. Any advantages that you can take of the existing workflow and how your app can fit into that user experience, I think that's very important for the adoption from the consumer standpoint. But it's also important from the person who's actually going to pay for it. Is it going to be Kaiser that's going to pay for it? Is it going to be the pharmaceutical company that's going to pay for it? Is it going to be the pharmacy, or is it going to be your insurance company?
I know a lot of people in this room, if you ask them what their run rate for their startup was, most of them would be excited if the thing survived. If it could go 6 months on the cash on hand, you'd be pumped. You're oftentimes looking at 90 days and wondering what you're going to do after that. Most people don't realize that the buy process for a hospital is about 2 years, because it takes anywhere from, you have to get on the budget cycle of a hospital system, and you have to do it the year before the budget approval for your purchase on your item. So if you do the math, that means that you have to be there the previous year to be available to purchase 18 months to 2 years later. And I've been talking to telecom companies recently, and I can tell you that their buy cycles are also in a similar curve of anywhere between 18 months to 2 years. So somehow or another, we have to figure out how to encourage and take little companies and keep them alive long enough so that the big boys in the big spaces can have enough time to identify, evaluate, choose, purchase, and integrate with solutions that in the long run will add value to their organizations. We are going to have to start demanding access to our own information, or choosing our physicians by the fact that we have access to our information. Because frankly, nobody's going to invest in attacking those kinds of problems unless there's a direct revenue-related impact of having the freedom of information as a consumer. That's my belief. And one of the reasons that Kaiser has a very strong cost motive. This is part of what he didn't mention is two things. One is their satisfaction scores go out of the roof through having a portal. Not because they provide better care, but just because they have a portal. Don't use the word. The second thing is that their cost structure has dropped dramatically. Sometimes, in some cases, your engagement costs for office visits have dropped to 25% or less.
Convenience factor. Now, as it turns out, there is the convenience, which is great from a customer's perspective, and of course to the extent that we can reduce what we call face-to-face. It's not so much reduce. The face-to-face interactions, let's say in the clinic, are for those members that truly need it. You can think of it almost the platform as a service, and effectively think of the apps almost as tools, and really what remains on top is the customization and branding, right? It's the same app. Once I enroll, right, I authenticate, instead of saying Sutter, it says Kaiser or UCSF or whatever that.
Walgreens.
Yeah, all Walgreens, right? And I think this is where we need to go,
Yes.
right, to get that sort of wider, adoption.
Something called FDA that always messes with you, and usually medical devices have to go through the FDA process. And mobile applications I believe are on this weird borderline regime where are they if you pitch them as a presentation layer and a dashboard, then they don't qualify. They don't have to go through as much of a rigorous validation process. Versus if they're qualified as a clinical decision system.
And this is actually what causes me the most fear, is all of a sudden somebody's going to find something that they believe has some core clinical efficacy with 1 or 2 short-term clinical trials, and then flip it out to the world, and in 6 months or a year, it's going to be disavowed. That they won't know anything. And all of a sudden, we'll know about it, and it'll destroy the sort of hope, if you will, the idea that if we can put technology in everybody's hands and help them manage their lives better, that we will have better healthcare and better lives. I think it's like when you talk about advertising and TV and commercialization of technologies, as you start to segment and break down, you start to offer more and more focused things to individuals to more and more be appropriate to their choices, personality, and decision making. So that's, I think that's the unseen challenge. I think reconciling those very dramatic difference in requirements is where we're going to see the industry. That's the part where you can't predict in the industry. I don't know where it's going to play, but I think that's a factor.
So that's essentially where we are now. So I think, how basically provide what the members want and need, right? Do it in a way that is highly integrated, right? It eliminates redundancy, make the information credible, and I think ultimately we move into an era of application prescribing.